activities. We have a football team. You people can join our football team. You can even make your team as an intake. We are going to have a sport day next month. This sport day will be interdisciplinary, preoperative versus CNA, September intake, CNA September versus CNA May intake or July intake. It's going to be interdisciplinary. So brace yourself for a good and enjoyable co-curriculum. Not only sports, our school participate in things like hikes, we visit places, we visit orphanages, we do those things that relate to what you can do as a caregiver or what you can do as a health practitioner. So we give back to the society, and sometimes our students also give back to the society. So come prepared to do the same when you're called upon. That one, you take part in that. I also want to talk about something that is sensitive. Most of our students are female students, and my wish as a person is that during your time of study, I wouldn't want anything that interferes with your study. And one of those things that interferes with studies, especially for our female gender, is expectancy. So we don't expect, we least expect that during this period you become expectant. And when this happens, please report so that your classes are not interfered with. There are some of you who are coming in, and they will be coming in to stay in some hostel accommodation. We have our hostels. Please note that those hostels have got their administrations, and your conduct there will determine whether you will continue to stay there or you will not continue to stay there. Nairobi is not a very friendly place for a student to stay outside the hostel, especially if you are alone. It's not a very, very friendly place. So try to be on your best behavior when you are staying in these residential properties that are manned by our school and administrations. So this one does not also mean that when you are coming to school and you are coming from home, you misbehave. We've had cases where students, your classes ends at midday, your parents expect you home at 4 or 3, but then you always arrive back home at 8 or 9. When we get such cases, we don't entertain, we don't condone such. Please, as I would love you to stick to the rules of the school, is the same way also your parents will love you to stick to the rules of your house. So stay guided and remember that the rules are rules, whether you are in school or outside school. As long as you possess our school ID, you are our student, whether you are inside the school or outside. So watch how you behave. I want to talk about something that will encompass everybody: drug and substance abuse. Please note, as long as you are our student, as long as you are wearing our scrub that is written Macmillan Medical Training College, you are not allowed to wear that scrub when drunk, after you have smoked, whatever you have smoked, after you even chewing mirror. We don't condone that, whether inside school or outside school. We know some of you might be doing those, but please don't do those things when you are wearing our school uniform or you know very well you're coming from our school. When these things happen, you will be met by punishment. Some of the punishment might not be very entertaining or might not be very pleasing to your ears, but when that time comes, we might be forced to take action. So stay guided accordingly. Finally, I want to talk about the relationship and conduct of students and members of staff. Relationship and conduct of students and members of staff. I want to echo so well that when you come here, sometimes you are a student that is a bit older. I want to start from that point. And you will find lecturers who are teaching you who are a bit younger. The canon knowledge demands that as long as they're your tutors, you accord them the respect that they deserve. You accord them the respect that they deserve. Number two, whether you are younger, whether you are coming from whichever background you are coming from, when you come to school, respect is paramount. There are instances where I know you are also a human being as a student. You might feel offended by a tutor, by an administrator. Don't take it and start screaming and shouting with it. Just approach the tutor, have a dialogue. We are all grown-ups. I don't know if we have a mad tutor at Macmillan. I've never had a case of a mad tutor, but I know that our tutors are people that if you talk to them, they will listen. Sometimes you have personal issues from your own, wewe mwenyewe, you have personal issues that there are some things that you can't do. And when your teacher tells you to do them, just tell them, I cannot manage to do these things. Please help me so that I can be helped. This thing will always happen. So I want us to have a maximum cooperation when it comes to the conduct between students and members of staff. If you see that your teacher is not approachable, you come and tell me. I will approach this particular tutor and we'll solve this, whatever is the issue, amicably. So I want to encourage you also that apart from just attending classes, we have a very good library. We have very good resources that you can come and borrow. So you also have time for your personal studies in the afternoon or whatever time you will be free. You come borrow books, sit down and study. Some of these medical courses sometimes might be tricky and might demand a lot of your time. When it demands a lot of your time, it means you have to take your time and study. It's only 6 months, it's only 1 year, it's only 1.5 years. I don't think if you spend most of your time studying and coming out here a competent or having mastery in whatever you are doing is a bad thing. It will be the best thing that could ever happen to you. Like Madam Principal just said, mark this day in your calendar. This one might be, I know it's not might be, I know it's going to be the greatest day of your life because you're going to learn academically, professionally, and again, most importantly, you're going to make friends with your classmates. You're going to make friends with your tutors. You're going to make friends with the admin, some of which might connect you to jobs in the future. So I urge all of you to come, feel very attentive, and also pay attention to instructions. I want to encourage all of us that are coming in that now that you are a student at Macmillan, an additional course of German language additional course has been added onto you and has been subsidized. Take this full advantage because, as you know, international jobs are gaining traction in Kenya and you should not be left behind. If you can take this opportunity and study these German courses also alongside your courses, especially CNA, perioperative, HSS, and even mortuary science, you can go a long way in securing jobs in the future. On top of that, as Macmillan Medical College, we have a sister company that links people to jobs abroad. So you are strategically placed, you are in a better place where you can come study perioperative, you can come study CNA, add German on top, and then Macmillan will ensure you get a job abroad. So you are in a better place. You don't need to struggle after getting out of Macmillan to go and find employment elsewhere. We will find it for you. So I welcome all of you to Macmillan. I'm going to share the this student handbook to you. I think in your WhatsApp. Again, before the meeting ends, we are going to share your personal timetables. Again, we are going to interact more in the coming weeks. On Monday and next week, I think we'll have physical orientation in your respective campuses. I welcome you all to Macmillan. And as it is said, education is not all about being number one. It's not all about securing good employment. You've come to learn so that you can develop, and you can develop as a human being, and also you can develop the way you are thinking. I want you to start thinking like a nurse. I want you to start thinking like a perioperative theater nurse. I want you to start thinking like a health support service practitioner, and then you will be there in no time before you know it. I wish you all the best. My name is Beldens. I'm the academic registrar. If you have anything matters pertaining to academics, you can reach my office anytime through the number that I will also share. Thank you so much, Madam Principal.
Thank you so much, Mr. Beldens. That's our academic registrar. We thank you for taking us through that very elaborate presentation. And we now want to go forth and finish the section that we are having. But most importantly is to remind us that you are here for a reason, and the reason above all is that you're able to study. The cut grade or the thresh marks that if you get below 80%, you'll be able to, for some of the courses, it's a fail for most of our courses. Therefore, as you come to Macmillan, where we need you to be excellent, you need to ensure that you are scoring 80% and above. So I want to bring forth to you our success stories. What is Macmillan about? What have we achieved as at now? During our more than 3 years of start, what have we done? So we can talk about our excellence, partnership and global accreditation. And number one, we can talk about strong graduation and employability rates. At Macmillan Medical Training College, graduates are thriving in Kenya's public and private hospitals, home care facilities, and globally, including Germany, USA, Austria, and Middle East. So we have students thriving in these places. As our registrar has said, we have an affiliate company called GHIC, where the main goal of GHIC is to link our students to jobs outside the country. We know the challenge that Kenya faces when it comes to jobs, and therefore our interest is to link you to jobs. So we also have industry partnership and collaboration. We have direct links with hospitals, NGOs, and industry partners to create real-world pathways for our students. So you're going to be beneficiaries of that. We also have program relevance and curriculum innovation. Our curriculums are shaped by healthcare needs, technology trends, and global best practices. Also, in terms of accreditation, we are fully accredited by the Ministry of Education and also under TVET and international bodies, including Skills Development Council of Canada. So I know the next presentation will be on CNA, and that's the Certified Nursing Assistant, where we're going to learn about Skills Development Council of Canada. So the certificates you're going to give you will not only benefit you within the country, but also outside the country. We also have ABMA, ICDL, among others. Then we have an amazing alumni success story or stories from local clinics to international hospitals. Our alumni are leaders, they are caregivers, and they're innovators making an impact worldwide. So when you come here, be ready to make that same impact. We have the student support system, where we have personalized counseling, mentorship, and guidance to ensure that every learner succeeds. So if you have any problem, if you need to reach out to someone, if you need to talk to someone, don't be afraid, reach out to your center managers or administrators. Let them know that you're in need of counseling. We shall provide free counseling to our students, mentorship and guidance in terms of careers, in terms of just general counseling. We are here for you. We also have community engagement and impact. So we visit children's homes to Nyumba ya Wazee. Our students give back, building compassion alongside competence. So it's not just about being a bookworm or just always studying, but above all, there's compassion, and we always try to give back to the society. Of course, in terms of expansion and growth, We have a newly established hospital, that is Macmillan Hospital. It enhances healthcare delivery while serving as a teaching and research facility, giving students direct access to clinical practice. So some of you will be very lucky to be employed or to intern or to volunteer at Macmillan Hospital. It is a great resource to us, Macmillan Medical Training College. Above all, we have a world-class simulation skills lab. We have a very nice skills lab for all our campuses. But for Nairobi is the newest one. We have upgraded it because we are looking at starting a school of nursing. Therefore, our already launched state-of-the-art skills lab provides hands-on, real-world clinical training, equipping learners with confidence, precision, and global standard competence. So it is a lab second to no other. So the kind of lab that you will find at Macmillan Medical Training College, you will not find it at any other institution. You're going to have the full experience, whether it is bread making, whether you want to check for vital signs, whether you want to see how their heart works. You'll find all this in our labs. So count yourself lucky today. You will have an experience that not even KMTC students have had. So you are top among the rest. So at Macmillan Medical Training College, shaping the future of healthcare, locally rooted and globally accredited. That is what we are about. So at Macmillan Medical Training College, we believe education is not just about acquiring knowledge, it is about building competence, confidence, and character. Here, you will not only learn skills, but also discover the leader, innovator, and global citizen within you. I'll take that again because it is very important. And like I said, mark this day on your calendar. Here at Macmillan Medical Training College, you will not only learn skills, but also discover the leader, the innovator, and the global citizen within you. Over the next 2 hours or less, this is in terms of the orientation time, we'll be introduced to our values, our structures, and opportunities that define our college. You will meet the team dedicated to your growth and explore the pathways that will make you from being a learner today to being a professional tomorrow. So we are swiftly moving from just being learners, but we are shaping you into professionals, tomorrow's professionals. And as we begin, I leave you with these words to carry in your hearts. Every great journey begins with a single step. Today you have taken yours at Macmillan Medical Training College. With that, I officially declare the orientation open. I want us to learn. I want us to hear everything about Macmillan. At the tail end, we are going to have a segment where we're going to have the question and answer segment. So thank you so much to you, the people who have attended. I see the attendance is very good. We are having people from Facebook joining us. Karibuni sana from Facebook. On our chat box, we're going to have a Google form. Kindly register. Let us know that you have attended this meeting, that you have attended this orientation meeting, and that for any sort of help, we'll be here to assist. So next in line, we will have Samia Sinali, who is the HOD for the German language, coming in with their presentation and just taking us through the German language, know what is the German language about. If you want to study, what do you need to do? And just sharpen our skills in terms of the German language. So karibu sana. I want to welcome Mr. Sinali to take us through the job placement. Other than just Germany, there's other countries that we have. So Asinali will take us through that, and we'll get to know what jobs do we have, what jobs can we get out there, what are the opportunities that we have as students, as prospects at Macmillan Medical Training College. Karibu sana, Mr. Asinali.
Thank you very much, Madam Sarah. Hello, everybody. Good afternoon. Can you hear me?
Yes, Mr. Asinali, we can hear you loud and clear.
Oh, okay. Thank you very much. Thank you very much. Welcome our students, Karibuni Macmillan. This is one big family. 4 branches spread across the country. I might have interacted with some of you. Some of you might not. You might not yet have interacted, but I would like to tell you a very big Aribuni at Macmillan. You have made the right choice in terms of the progression of your future and your career. Now, if I've interacted with any of you, I have shared this particular concept that in Macmillan, we believe in a mentality of growth. We don't believe in getting stuck at one particular point. So you may have enrolled as a student or a CNA or perioperative or any other course, and you may want to advance further, or you may want to practice in other countries, because looking at the employment situation in the country, there is an oversupply of labor and an undersupply of work opportunities. And with that in mind, Macmillan has taken these needs of students into consideration and created partnerships and mechanisms for our students to be able to practice abroad. So I will be guiding you through the job placement and the apprenticeship placement provisions at Macmillan. I don't know who is in charge. Can I share my screen? Madam Sarah?
Sure, a minute. Okay, Asila, you can pick it up. Just give me 2 minutes. We'll have you be able to share the screen, but you can continue.
Okay. Sawa, that is okay. So at Macmillan Medical Training College, we partner with international employers to be able to provide job placements and situations for apprenticeships in other countries across leading destinations. We have a presence in that should be 4 continents so far, and we are expanding on the same. And there are various target professions that these programs cover. Depending on the country, the most famously, or the most known or the most common of these would be nursing, social work, engineering, IT specialists, special needs educators. But as I have mentioned, the list goes on beyond this. For instance, in Germany, we have links to up to 350 jobs, 350 career pathways that someone can follow in the country. So currently, as I've mentioned, we have a presence on 4 continents. We have a presence in Canada, the United Kingdom, the country of Ireland. We have a presence in Germany, in Austria, in Qatar, in Saudi Arabia, in Australia, and in New Zealand. And each of these usually has its own requirements and provisions as well. So generally, you would be required to have your academic certificates and transcripts, a valid passport, completed medical checkup, and also personal details and documents that are up to date, the details like CVs, referees, and pass them on. And we do offer these services to our students, some at a subsidized fee and some for free, consultation services, and so on and so forth. And each of these varies by country, and each of the provisions also varies by country. So the first country that I will...
You can share your screen. Sorry for that.
Okay. I'm breaking. Can you hear me now?
Yes, we can hear you. So the breaking, I think, is on your end, not the presenter's end, because we can hear him very clearly. So kindly check your internet.
Oh, okay. I hope you guys can see my screen.
Yes, we're able to see your screen.
So each of these countries has its own particular requirements and also particular advantages and benefits that it offers. For example, starting off with Canada, Canada has quite a sharp shortage of nurses, social workers, IT specialists, engineers, and healthcare support workers, many of whom are already many of our courses which are tailored around the same. So once you have finished your courses in Macmillan, you have studied your CNA or you have studied your perioperative technology, or you have studied any IT related course, or whichever other documents, whichever other certifications that you may be having, we have what we call the Career Path. Macmillan works alongside a partner organization called GHIC, Global Health Immigration Consultancy. And together we make this process seamless and smooth, transparent, and also effective for our students. So for Canada, one will be required to have an IELTS academic certificate or a CLB7, which is the minimum requirement, with a score of around 7, which is the minimum for healthcare roles. Also, there will be licensing, proof of funds, immigration and work experience. The same will be shared in future webinars for particular details on the same. We also have a presence in the United Kingdom, which also has similar requirements. We have Ireland, we have the country of Ireland, which also has similar provisions. Then we have Germany, and Germany has various pathways through which one can go. My colleague after me, Madam Daisy, will share on the same. I think Madam Sandra will also touch on the same when she's covering the German language program. But I usually tell students, maybe my heart is really into Germany because I'm the HOD of the German language department. But this is advise students to pursue, to go to. There are positions for over 350 opportunities in Germany, varying from skills like baking to other skills like nursing and other medical related courses. So we have a number of provisions for the same. And for Germany, we also have apprenticeship programs. Apprenticeship programs are programs where you are able to expound on your knowledge and also earn at the same time. So let's assume I have done my CNA, my Certified Nursing Assistant Certificate, and at this point I am a CNA. I will be working as a nursing aide under nurses or in various departments in the hospital or in specialized care. And maybe I want to advance. I want to be a diploma nurse. I want to be a degree nurse. I want to go do my master's. I want to go do my PhD. Now, one of the best countries, and I'm speaking only, I'm not only speaking of CNA, but you could have done your perioperative technology, you could have done other courses, and you want to advance in the same. Now, Germany provides one of the best situations for you to be able to expand on your knowledge capabilities. So even for those of you who are interacting with, who maybe were looking for nursing and we yet have diploma in nursing, and we haven't yet introduced a diploma in nursing, I was telling them you can do the German language program and go pursue the nursing program in Deutschland. So what are the requirements for Germany? So usually a B2 German certificate is required. We train students up to level B2. We provide exam guidance. We provide interview preparation services and the rest just to ensure that one is able to make it to this country. And the pay is good. The provisions by the country are good. Within 5 years, you're able to get a citizenship into the country, and you're able to also enable other members of your family to move to the country once they have a E2 German certificate as well. And usually with Germany, you will be able to go advance your skills free of charge because most universities in Germany actually do not charge a fee. Fun fact. And we have several students in this particular country. Now, beyond Germany, we also have Austria, and Austria also provides similar provisions. Now, Austria is a bit interesting because in some cases, individuals are able to go with a B1 German certificate, but I tell people just to be safe, have a B2 certificate at least. We have students who are already present in Austria, and they also are doing the same program, expanding on their knowledge while working at the same time and securing the benefits of both the strong social provisions in the country as well as the economic benefits of these particular countries. And one thing with Germany and Austria is that they also allow one to get into the greater EU region. German is spoken in 6 countries. So beyond just Germany and Austria, you're able to get into Belgium, you're able to get into Liechtenstein, you're able to get into Luxembourg, you're able to get Austria and other countries using this particular knowledge. So it is a knowledge I will encourage all of us to pursue and also with an interest in career growth and career advancement. It is a pursuit I would encourage a lot of us to leverage. We also have a presence in the Middle East, in the countries of Qatar and Saudi Arabia, usually within healthcare related fields, but also in terms of, but also in other departments like IT. And for here, you also have requirements like licensing, academic and professional certificates, and the violent passports. Macmillan also offers first aid and BLS
Sorry,
training.
Asidali, you're a bit shaky.
My network?
I think it's your network, but you can retake the last one.
Oh, okay. So I mentioned that we also have a presence in the Middle East, in the countries of Qatar and Saudi Arabia. And given the comprehensive study, the comprehensive coverage that you will have done while you will have experienced while you're at Macmillan, considering that you'll be living with several certificates, for instance, if you're doing DNA or perioperative technology, then you are very well leveraged to go work in these particular countries. Now, I know there is one fear that most people have when it comes to working in the Middle East, that is working under unfavorable conditions. Our partners and us ensure that you get the most favorable of conditions, that you go there as a skilled worker and therefore protected, have your rights protected. The process is very transparent and smooth for all our students. Now, to the south, we also have a representation in Australia and in New Zealand for similar situations. So for these ones also, you will be required to have effective training for the same skills assessments and visa interviews and everything. And basically, what is needed for me to get placed, either for a job or for an apprenticeship? And there are various elements that are required. Number one, we have the initial documentation. So your academic certificates and your transcripts, your passport and your CV and all other documents are usually put in order. If there is need for translation, for example, to countries like Germany and Austria, we also have the same. If there's need for notarization, that is usually done at a cost for students, but it's affordable. So notarization is where a legal company, a legal entity like a law firm leverages its position to verify that your documents are accurate and genuine. Then we have medical checkups. So after all these elements of all these academic certifications and application procedures have been put in order, we have medical checkups completed locally to confirm that one is fit for service in the particular countries they will be going to. Then at that stage, we have employer interviews. These are usually conducted virtually if they're being done in the country. For example, the Middle Eastern countries do it virtually or also in person. For example, in countries like Germany, in some cases, you find people having in-person interviews at the embassy, especially. Then you have contract signing. Once you have successfully completed your interview and passed, we have contract signing. So in this case, you have agreements on salaries, benefits, visa sponsorship, and any other matters that may arise that need clarification. Beyond that, we now move to visa processing. We also assist with visa processing for these situations. Then we have embassy interviews, which are required for final approval where necessary. There are particular countries where you have to get to the embassy, do an interview to confirm that you are fit before you are granted before you're granted a visa and a work permit for the country. Then you have travel and arrival. We have flights that are arranged and accommodations are secured. We have what we call welcome committees in different countries and different states. So we will take you to the airport, of course. But once you get beyond that point, we also have contacts on the other end that receive you and ensure that you are that your debut into this country, that your initial days in the country that you're moving to are smooth and well catered for. Then you have onboarding and training. So these ones are country specific as well. Now, once you've moved over there, if you're going as a worker or if you're going there as an apprentice, then there is the onboarding process where you now get integrated into the company and the frameworks that you're going to be working in those particular areas. So that's basically it about it. The only advice I have for us is we prepare our documents early, stay updated on the requirements and the same, and we reach out in situations where we need any form of support because we offer support the last mile at Macmillan. So I usually encourage students leverage the resources that you have, the knowledge that you have, keep in touch with the members of the administration or with your tutors to be able to identify the career opportunities that you may be able to pursue in the various fields that you're doing, whether you want to work locally or internationally. That is all from my end. I don't know if, I think we'll handle the question and answer section, but is that okay?
Yes.
Okay, thank you very much, Madam Sarah. I think I will now pass on to Madam Daisy, who will be handling the Ausbildung program for Germany.
Thank you, Mr. Sinali. We are grateful for that very elaborate presentation. I hope we now stand guided by that presentation, but we are open for career counseling, for any sort of service that you may need in terms of immigration services. We are here for you. So thank you so much, Mr. Sami Asinali. We can welcome Daisy to take us through with her presentation on the apprenticeship program. So I know some of you have learned about apprenticeship program. Some of you know about it, some of you don't know about it, but it would be good that we have an understanding of exactly what is the apprenticeship program, who is viable to sign up for this program, what are the benefits of this program. Karibu sana, Miss Daisy Gordon. There's someone with a device, Samsung. Kindly mute your microphone. You can take it up.
Hello, I hope
Sorry, Madam Daisy, I think there's some interference with your device. We are not able to hear you really clearly.
me.
Yeah, I think it's a bit better now.
Okay, thank you so much, Madam Sarah, for that opportunity. Good afternoon and welcome all to program. Today I'll be taking you through medical training.
Okay, I think we'll give Madam Daisy a minute to have her gadget fixed, unless interference from our side. Kindly someone confirm that there was a bit of interference, Mr. Orwa or Madam Winnie? Were you guys able to hear Madam Daisy clearly?
No, she was not. We couldn't hear her properly.
Okay, so she will work on her connection, then we'll have her back. Meanwhile, let's have Miss Dorcas Jebibot, a CNA tutor, take us through the CNA segment, and then we will go back to having Madam Daisy. Thank you so much. Daisy, kindly fix your gadget. Amazing. I see Miss Dorcas Jebibot is already here, ready with her presentation. So karibu sana, Miss Dorcas.
Okay, thank you very much, Madam Sarah. So I'll go on with my presentation. I hope everyone is able to hear me clearly. So
Yes,
I'll be taking you through Certified Nursing Assistant course and Health Service Support Level 4. So when you talk about CNA, what is a Certified Nursing Assistant course? So this is a course that provides a foundation in healthcare, and it is designed to prepare students and support nurses in providing essential care to patients. So when one is pursuing CNA, they will be working under the supervision of a registered nurse, and they'll be assisting the patient in performing day-to-day activities. And when you talk about who's a CNA, so a CNA is a healthcare professional who has studied the course certificate in certified nursing assistant, and they provide the patient with assistance with activities of daily living. So one of the responsibilities that a certified nursing assistant is able to perform in the hospital setup, we have bathing the patient, assisting with grooming activities. Those patients who are having difficulty with feeding, the CNA is going to assist that patient. Then they also take the patient's vital signs like the temperature, the blood pressure. They assist patients who have problems with their mobility. Maybe they're recovering from fractures, they're recovering from stroke. So CNA is going to assist this patient with mobility. Also, they ensure that the patient is comfortable and safe always. And they work closely with nurses and also other members of the healthcare team. We can have the doctors, the nutritionists, the physiotherapists. So a CNA also works hand in hand with other members of the healthcare team. So when it comes to the duration of study, how long does it take for you to study to become a certified nursing assistant? So the course duration of study is 6 months. And in those 6 months, it is divided into 4 months of theory. So you'll be doing physical classes for those joining the physical classes. They'll be doing 4 months theory, and this goes hand in hand with the clinical skills in the skills lab. Then the remaining 2 months, we have the hospital attachment. So we have those who come physically for the physical classes in individual campuses, and those who are not able to attend the physical classes, they can as well attend the online classes. So when it comes to what you study to become a CNA, so you hear the term CNA, but an overview of just some of the few topics that you will get to study when you start this course. So you study about basic nursing skills. We have anatomy and physiology. So you'll be learning about the structures of the human body and how these structures function to assist with the functioning of the body. Then we have infection control. Here we'll be learning about hand washing, how to wear the necessary personal protective equipment like the gloves, the mask, the gown. Also, we'll be talking about nutrition and hydration, very important communication skills. You'll be communicating with the patients, other healthcare providers, the patients' relatives and friends. So you need to be having good communication skills. Also, we have patient rights and ethics. You need to understand the rights that patients are entitled to in a hospital and how to handle different cases regarding patient care. And also we have first aid and CPR, that is cardiopulmonary resuscitation. So during this course, you will undergo a training, a first aid training and a basic life support training, and you will be given certificates on the same. So that in the near future, you'll be looking for a job and you have this first aid and basic life support certificates. Employers are going to take you in because you have additional skills in first aid. When it comes to settings, where can you work as a CNA? So as a CNA, you can work in a hospital, you can work in nursing homes, you can work in clinics, we have rehabilitation centers. Also, you can be taking care of patients in their home environment. Those patients who have been discharged from hospital, but they still need medical attention. So you're going to be attending to them in their home environment. You can work in hospice, whereby you'll be taking care of patients who have terminal illnesses. So let's say we have a patient with diagnosis of cancer. So these are patients who are placed in a hospice center as they recover. Then we have assisted living facilities. So when it comes to the areas of specialization, this is going to depend what you are good at. If you're good with working with young children, you're going to work in the pediatric department. Among the elderly, you're going to work with the geriatrics. Then we have rehabilitation, whereby you'll be taking care of patients who are recovering from illness or injury. Also, we have mental health support. You'll be taking care of patients who are diagnosed with psychiatric conditions. We have surgical units. And in surgical units, you'll be assisting those patients before they undergo surgery and after surgery. Then we have the home-based care, taking care of patients in their home environment. And we have palliative and hospice, which specifically deals with patients who have terminal illness. And you are taking care of them in their end of life. When it comes to the benefits of studying to becoming a CNA, so one of the benefits is quick entry into the healthcare field. And we have also high demand in the job market. We also have opportunities for growth and specialization. You can finish your CNA course, you decide to advance your studies. You do other healthcare related courses. And generally, it is fulfilling working as a healthcare provider. You'll be assisting patients, you'll be making a difference in their lives. When it comes to health service support, here at Macmillan, we offer the two concurrently. We offer both CNA, that is Certified Nursing Assistant, and also we offer health service support level 4. So I'll be discussing more about what is this health service support course. So health service support level 4 is a TVET competency-based certificate for trainers who want to learn about providing essential care to patients in facilities. Health service support level 4 is also called caregiving, and it trains learners in direct patient care. So you'll find that they share some topics with CNA, and they also have their own separate topics. When it comes to generally what you study in health service support level 4, we have topics like housekeeping services, we have catering services, nutrition, pre-departure training. So those who want, those who are willing to apply for jobs, the way Mr. Senali was explaining, will be offering this topic pre-departure training, and you'll be able to understand what you're supposed to be having, what you're supposed to prepare in pre-departure training before you relocate to a new country. Then we have special needs care, psychosocial care, and also we have first aid. When it comes to the examining body and certificates, health service support level 4 is examined by TVET CDAC. So TVET CDAC is technical and vocational education and training curriculum development. So service support level 4, you're going to do an exam from TVET, and you're going to be given a certificate from TVET. When it comes to level 5, you can advance from level 4. Once you finish level 4, you can advance to level 5 and even level 6. So when it comes to level 5, the KHQA, which is Kenya Health Professional Oversight Authority, is the regulatory body for level 5 and above. And the good thing about doing HSS level 4, you can progress your career pathway. You can finish level 4, you progress in doing HSS level 5. So the difference here when it comes to level 5, you're going to have more increased clinical skills, extensive knowledge, and even formal recognition. When it comes to job linkages, whereby CNAs or caregivers are able to work. So CNAs are trained at Macmillan. They can pursue job opportunities abroad. They can work in countries like Germany, New Zealand, Canada, Austria, and also Saudi Arabia. So the two certificates that you'll be given, for the one used for caregiving, you'll be using when you're looking for a job locally in Kenya. The one for CNA you are going to use when you'll be applying for jobs in other countries. When it comes to why choose Macmillan to study CNA or caregiver, so here at Macmillan, we offer Canadian Certified Certificate, which is provided by Skills Development Council of Canada. So this one is globally recognized. And also we have our certificate for caregiving, which is provided by TVETA. Also, why you should study at Macmillan. Macmillan is accredited. We have up-to-date curriculum which align with the global trends. You can be able to work in anywhere you can be able to work in other countries with your certificates. And also we have hands-on clinical practice in top hospitals. We offer career mentorship and job linkages. We have experienced tutors and modern skills lab. By the time you are done with your study at Macmillan, you will have gained extensive knowledge and skills from our tutors, our equipment in our skills lab. Also, we have a culture of compassion, professionalism, and excellence. So I welcome you all to study at Macmillan Medical Training College. You're going to have extensive knowledge and skills. You'll not be the same person you joined today. After 6 months, you're going to be a different person. So thank you, Madam Sarah, and back to you.
Thank you so much, Ms. Dorcas, for that elaborate presentation. I'm sure we have learned a lot. We now know who a caregiver is and what they do. Thank you so much. I take it back to Daisy. I hope she's set. If not, we could have Sandra go in first, then we go back to Daisy. I think she's setting up. So Sandra, kindly take us through the German language training, what it entails, and the levels of the German language. Thank you so much. Sandra.
Okay, my name is Sandra Otieno, German language tutor at Nakuru campus. Can I please share my screen?
Sure.
Dorcas, can you, I can't share when your screen is still sharing. Thank you. Okay, so congratulations to those who have chosen to study German language. I also want to encourage those who have not to also register, because it's a decision that can open doors for your personal, academic, and also your professional growth. So who can study German language? The German language is open to everyone, no matter your background, your age, your profession. German can be studied for different reasons. For example, German can be studied by students who are planning to study in Germany, Austria, Switzerland, and other German-speaking countries. German can also be studied by professionals who are seeking jobs in German-speaking countries. Travelers also want to enjoy their trips in German-speaking countries, language enthusiasts, business people, and so on. Now, overview of the German language. German is spoken by over 1 million people in Europe. So the official language of it is the official language of countries like Germany, Austria, Switzerland, and Liechtenstein. So it is ranked as the second most popular language in Europe after English. So why should you why should you learn German language? So knowing German can make you a more attractive candidate for jobs in various sectors like finance, IT, healthcare for the CNAs and nurses, and also in the tourism sector. So in those fields, German-speaking staffs are highly recommended or valued if you're going to look for jobs in those countries. Whether you want to travel to German-speaking countries to work, or maybe you have relatives living in Germany and you want to go there for a visit, learning German will help you with the basic travel needs. For example, when you want to ask for directions, when you want to order food in restaurants and booking hotels and tickets, you can also communicate with the locals easily and make friends and even build a very strong network. Germany offers many study scholarships through the German Exchange Program Service, and proficiency in German language increases your chances of securing these scholarships for undergraduate and postgraduate studies. There's also the Ausbildung program that Basil will talk about. The Germany's vocational program, which combines theory and practice. It always takes around 2 to 3.5 years, depending on the profession you're taking. And at the end, you get a nationally recognized certificate. So the requirements are usually at least a secondary school completion and German language B2 level, because classes and workplace communication are always strictly in German language. So, what are the levels of the German language? So we have level A1. Level A1 is the beginner level. Here we will learn around 500 words on topic like seasons, shopping, numbers, and so on. We'll also learn the basic verbs, the pronouns, the present tense, and write simple emails, introduce ourselves and others, and form very basic questions. In A2 is the elementary level. At this level, we will build on the A1 basics to participate more in simple conversations. In B1, the intermediate level, you will be able to engage in conversations on familiar topics and even hold these conversations for between 10 to 20 minutes. You will also be able to write about your experiences, your views, and your plans. In B2 is the upper intermediate. You will be able to understand more complex statements, engage in everyday life conversations with ease, and understand complex topics and texts. Now, German language course. The German language course is available online or in person based on your preference. Exams will be taken on campus regardless of the learning way, whether you're taking it online or physical. Exams are strictly taken on campus. The normal classes takes 2 hours per session. The intensive classes 4 hours per session. And German language can be taken concurrently with CNA and any other courses. So cost and duration of German language. So each level, A1, A2, B1, and B2 is structured to provide comprehensive language skills. Duration is always A1 takes 2 months, A2 2 months, B1 3 months, and B2 3 months. The tuition fees for A1 is 15,000 shillings, A2 is 10,000 shillings, B1 is 10,000 shillings, and B2 is 10,000 shillings. Now, in conclusion, or rather, exam structure for German language levels. So A1 and A2 are offered internally at the institution, and the exam is 5,000 per exam. B1 and B2 exams, B1, you can either do B1 here at Macmillan Medical Training College, and then B2, you can do them at Goethe. But if you want to use your B1 certificate for maybe jobs in Austria, like Ausenali had said, you can go for the exams at the Goethe Institute. So that is the official certified body for German language. So certificates from the Goethe Institute are recognized by the German embassy. The importance of German language proficiency. What is the German language proficiency? So it provides a strong command of the language, allowing for fluent communication in complex situations and discussions. It offers significant advantages over lower levels by enabling effective interaction with native speakers and access to advanced professional and academic opportunities. So we highly recommend B2 level. Remember, the higher the level, the higher the number of opportunities. In conclusion, I want to look at the German language. The German language is very easy and fun. Look at these words we have here, like that word there, Professor, Kindergarten, Sommer, Vater, Mutter, Winter. These words are very familiar and easy to build vocabulary with. Okay, so the German grammar is detailed and systematic also. As soon as you understand the rules, the German language becomes predictable and easy to use. And the word order in a sentence always follow a consistent structure. Therefore, the language is much more easier. Okay, now, what do you expect during this training, the German language training? So we will focus on all 4 skills, that is listening, speaking, reading, and writing. And remember, we won't be memorizing, but we will be using the language in real life situations. But we will go step by step. We will start by the basics, introducing yourself, asking simple questions like, what is that versus das, okay? Can you help me? Können Sie mir helfen? And so on. Everyday vocabulary, and then gradually moving into grammar and more complex conversations. So we will also have role plays, for example, at the doctors, that is by us, group works, dialogues, and trying to maintain a conversation in German language for around 5 to 10 minutes in level A2 and B1. B1 is even more, at least 15 minutes to 20 minutes. So all these activities will be part of our sessions to make learning fun, lively, and very practical. So what is your role as a student? So you know language learning needs teamwork. We as your tutors, we will guide you and support you, but your participation is also key. So be consistent. That means you should practice every day. Don't be afraid to make mistakes. Here at Macmillan, we allow mistakes, okay? They are part of learning, and always be curious. Practice beyond the classroom. Watch German videos, listen to German music, or even label things in your home in German. Okay, so once again, willkommen und viel Erfolg. Welcome once again, and I wish you all the best.
Thank you so much, Sandra, for that amazing presentation. I'm already getting inboxes and someone is asking if they could start the German language class. They were not prepared for it, but out of the presentation, they feel like they now have the need to now start studying the German language. At Macmillan Medical Training College, we listen to our students and we attend to their needs. And therefore, we would allow the students, if you have signed in for the CNA class and you would want to add the German language to it, if you have signed in the perioperative class and you want to join in the German language, we'll give free classes from Monday to Wednesday for you to get prepared on how you could start the class. So from Monday to Wednesday, we will allow you, our students, whether physically or virtually, to attend the German language class, start learning. We have seen it as basic as it looks. You only need to put in the effort and have the dedication and commitment to learn the language. Therefore, we'll have our students attending our German language. I see we have most participants here, and I see already someone has reached out to my inbox and they are saying Thank you so much for that great opportunity. So if you are here, you've not enrolled for German language, and you want to enroll for German language, you're not so sure if it's a strength that you would be able to pull through, we invite you to our classes, both physical and virtual. Join our classes for free from Monday to Wednesday next week. And then we'll expect that you'll make payment, and now you go in and study in full force. Thank you so much. We now have Madam Daisy take us through the apprenticeship program.
Thank you, Madam Sarah, for the opportunity to present the Ausbildung program. Good afternoon and welcome all to the orientation program. I'll be taking you through the Ausbildung program, which in English is the apprenticeship program under the German language. Yeah, so I hope you can all see my screen. This is just to show you what to expect of the German culture, and German language is open to all to learn. People within African countries, people outside the African countries are all welcome to learn German language because it exposes you to various opportunities outside and gives you more benefits. If you learn German language, you have it as an added advantage to your course. So under the Ausbildung program, we are able to learn about the labor market of German language, which states that it needs over 1 million workers by the year 2035 to fill vacancies because they have low turnout of healthcare workers in Germany. So they're looking for healthcare workers to work in these countries. And that's why we are opening up this opportunity to our students. The health system guarantees job security and very high salaries or incomes. The healthcare system offers enormous opportunities for advancement. The German population is getting older and is already urgently looking for doctors, nurses, and other healthcare professionals. We have many cities that have too few established doctors who are practicing in the healthcare system. So this picture shows us how you're able to learn in the years that will be taken through under the Ausbildung program. So the first year, what you're expected to earn is about 750 euros to 1400 euros. In the second year, you can earn a stipend of 850 to 1450 euros. And then in the third year, you can earn a stipend of 950 euros to 1650 euros.
Sorry, I think Daisy is also fixing her screen so that we are able to see as she shares. I know it was stuck on the first page. So it is good that as she speaks, we're able to also see. Thank you, Daisy, for moving it. I think there was a table.
All right, sorry about that. Yeah, so I hope you can all see my screen now. I've taken you through the German labor market overview. So we are going to move on to the next slide, which is about the Ausbildung path. This shows us how someone is able to earn in the first year, in the second year, and in the third year. So when you get into the Ausbildung program, remember this is an apprenticeship program where you learn as you earn. So this means that aside from working under the Ausbildung program, you're also given an opportunity to advance in your career in German language or also in the healthcare system, like if you're a CNA. So when you start in the first year, you can get a stipend of 750 euros to 1400 euros. In the second year, you can get a stipend of 850 euros to 1450 euros. And in the third year, you can get a stipend of 950 euros to 1650 euros. So on to the next slide. It states the requirements for you to participate in the Ausbildung program. First off, it's your education. You must have completed your Form 4 education and have a certificate. And the entry grade is a C minor. So because this program is suited for recent graduates and young professionals. The language requirement is a German language B2 level certificate. You must also be motivated enough and interested in the program and have a strong desire to work in the field. Remember, you have to learn German language for you to work in this, so you must have the motivation to be able to work in that kind of environment. You must also be able to adapt to a new culture and language. And then you should have no criminal record. The age limit is between 18 to 40 years old. For the work experience, you may need some work experience in a related field. The visa, you may need to apply for a visa to work in Germany. On to the next slides. What are the benefits of the Ausbildung program? First off is financial stability and support. The program provides the students with financial aid, that is a monthly stipend or an upkeep fee of between 750 to 1400 euros, depending on the program. So the stipend increases by 100 euros monthly. So this means that you may be offered a permanent position with the company that you completed your apprenticeship with. This means that when you get a chance with a certain company, they can absorb you as one of their staff permanently to work with them. So you might get a job opportunity under the Ausbildung program. Practical experience, you get a chance to work alongside experienced professionals in your chosen field, putting your knowledge into practice. You remember we say that great minds think alike, and when you are able to work with people with such great experiences, they will share with you their knowledge and you'll be able to advance in your career as well. So networking, during your training, you meet different people from different countries and learn German cultures, which will help in career development. On accommodation, you may or may not get accommodation. This is entirely dependent on the company that absorbs you under the Ausbildung program. So some of them offer accommodation and some of them might not offer the accommodation. And also it states that the living expenses in Germany are between 550 to 600 euros per month. So within 2 to 3 years, you will have a diploma that will allow you to work full-time and even further your education at German state-supported universities. Now, this is the best part of it, is that you can be able to advance in your career. And because of that, we are able to learn that in Germany, education is subsidized. That means it is cheaper to learn or to advance in your career. So you can be able to get free training under sponsorship, or that is the train as you earn, to earn a diploma degree in your chosen field. And then on completion of diploma, and even after getting your certificate, you can advance to degree, to master's, and also to PhD. So on travel, and you can be able to travel with your dependents, that is if it's your wife or your husband or your children. And then you are also eligible to get 30-day leave if you're working. Then from this apprenticeship program, you can work at a BMW, which is beneficial for those who have done engineering. Yes, so also this shows us the career progression for a nursing student who has gone to work in Germany or who has gone under the Ausbildung program. So a nurse can start at 3,200 euros, then progress to 4,200 euros, and then finally 700 euros. On to the next slide, we're going to be looking at the placement opportunities that Ausbildung can place you in. But the Ausbildung program is under Germany, under German language. So it's open to nurses, social workers, we have engineers, we have IT specialists, and we also have special needs educators who can be able to get access to the Ausbildung program. Yes, so this also shows us the placement opportunities that we have, but this is not under the Ausbildung program. This is under Macmillan Medical Training College with the job linkages that we get as an institution to our students. The requirements for these are usually a certificate and your transcripts, the ready passport, the medical checkup, the personal details that are in order. These are the requirements that you're needed according to each country. This is mostly dependent on the country that you'd like to work in after your studies as a CNA. So for the German language, Germany is always open to professions like nurses, social workers, engineers, IT specialists, and also special needs. For the Ausbildung program or the apprenticeship program, it's available for social workers, for engineers, for IT specialists, and special needs educators. And the candidates need a B2 German certificate. As I had shared earlier, for the process of getting the Ausbildung program, you must have a valid passport, your documents must be in order, you must have a B2 German certificate, employer interviews and contact issuance. Employer may sponsor visa partially or fully. We have embassy interview for visa approval. There's arrival in Germany where you're going to be picked by a representative and provided with accommodation for around 3 months. And then we have nurses that undergo placement exams or training for 6 months to 1 year to get a German license. So that's all from me under the Ausbildung program. Thank you so much for listening in. I hope it was a fruitful discussion for you. Thank you.
Thank you so much, Daisy, for taking us through. That was amazing. I now want to welcome Ms. Janice Okoth to take us through the certificate and diploma courses at Macmillan. You may have a brother, you may have a sister, a cousin, a relative, a friend. You'd recommend these courses to yourself. So it's good that we know these courses and understand them so that if you're coming in for perioperative and you're asked which is the examining body, you're able to know it's TVET CDAC. If you don't have this information, you might not be able to answer such questions. So let's have Ms. Bernice take us through this certificate and diploma courses offered at Macmillan Medical Training College. Before that, on the chat box, we have a Google Sheet or a Google form. Kindly fill it in for us to know that you're in attendance. It will help us and guide us to know who was in attendance of this meeting. And then we are going to communicate through the same because we're asking for your phone number and your email address. So let's have everyone fill in the Google form, whether you are a student, a parent, a prospect, you've joined in for your sister to listen in. I encourage all of us to just fill it in. Thank you. We can have Bernice come in. Bernice, if you're in a meeting, you could say hi to us. I know you could be working on your camera, but as you do that, you can let us know if you're in the meeting, if you're ready. We could move to finance as you prepare. Okay, it seems like
Thank you,
we'll
Madam Sarah. I can hear you. Sorry for that layover. Let me just do the presentation.
Sorry, there's a bit of echo. So I think if you're in a device where someone else in the meeting is in, they could excuse you so that we don't have the echo. And then we can
That's
fine. So as we wait for Bernice to set up, we could have a question. If there's anyone with a question, if there's anyone who wants to ask something through the chat box, we can ask our questions. I see Bernice is ready. So we can have Bernice take it up, and then on the chat box, you may not have enough time to answer all questions, but you could take questions from now so that at the tail end, we'll be able to answer these questions. Karibu sana, Bernice.
Okay, thank you so much, Madam Sarah, for this opportunity. And I'm going to present on the certificate and diploma courses that we offer at Macmillan Medical Training College. First of all, I want to welcome each and every candidate who is here. I want to take charge and say thank you for joining our institution. You're at the right place. So I'm going to tell you the diploma and certificate courses that we offer at Macmillan Medical Training College. Now, our Medical Training College has a School of Computing, Informatics. We have School of Health and Applied Sciences. We have School of Linguistics and Foreign Languages. And under them, there is a course that lies in between there. Now, in my presentations, you're going to see MMTC. And when you see MMTC, I'm simply talking about Macmillan Medical Training College. You're going to see TVETA. When you see the TVETA, I'm talking about the Technical and Vocational Education and Training Authority. You're going to come across CDAC. When you see that, I'm simply talking about Curriculum Development, Assessment and Certification Council. You're going to see SDCC, and when I talk about that, I simply mean Skill Development Council of Canada, the one that gives us the, grants us the certificate for our CNA students, and they're able to get their jobs abroad. And then we have the NEC. When I talk about NEC, I'm simply talking about Kenya National Examination Council. I have the KCSE, that is Kenya Certificate of Secondary Education. We're also going to come across KNQA. And when I talk about that, I'm talking about Kenya National Qualifications Authority. Now, on to the first course, and this one falls under the School of Computing Sciences. So we have a course by the name International Certificate of Digital Literacy. And this is a qualification which enables people to demonstrate their competence in use of computers. Now, it is offered in modules. We have a pocket-friendly module packages which cut across ICDL Insights, that is one of the modules. We have ICDL Workforce. We have ICDL Professional and Digital Citizens. So those ones are among the modules that you are going to interact with when you do International Certificate of Digital Literacy. So the requirements for this particular course, someone just needs to have basic computer skills. And I know in this era, because everyone is using a smartphone, everyone is eligible for this course. We have an open entry in terms of age. That means anyone with the legal age from 18 years to 65 years who is willing and has a passion can enroll for this course. Now, the duration for this particular course is 1 week to 3 months, depending on the number of modules. As you can see, I've talked about 4 modules there. Now, depending on the number of modules that you're going to partake, will depend on the number of weeks that you're going to stay with us, but it is offered from 1 week to 3 months. Apart from that, the next course that we offer, both at diploma level and certificate level, we have perioperative theatre technology. And when I talk about perioperative theatre technology, even from the name, I'm speaking about the theatre assistants, all those who help the surgeons during theatre work. So they're also known as surgical technologists, and their scope of practice or their scope of work is to assist surgeons. They also assist the anesthetists, and the registered nurses during surgical procedures. They also prepare the operating room, sterilize equipment, and ensure that all supplies are present and restocked, so that when a surgery is supposed to be taking place, everything is well organized. They also prepare the operating room, they sterilize equipment, and ensure all supplies are present and restocked. Now, what are the requirements for this particular courses? Now, for the diploma program, it's running for 1.5 years, and the KCSE mean grade is C- and above. The certificate program usually goes for a year, and the minimum requirement is a KCSE mean grade of D plain and above. Now, this particular course is certified by the TVETA CDAC. I just talked about that. It is the body that regulates these courses, so that one fully gets the license to go and work in the theaters. So after you've studied with us, you'll have to sit for a licensing exam so that you can get your CDAC number, and be able to participate, or rather take part as a professional perioperative theatre technologist. Apart from that, we have another course that we offer both at mortuary science, at diploma level and certificate level. And I'm talking about mortuary science. And in this case, it really talks about learning embalming. And when I talk about embalming, it's just the scientific term for preservation of dead bodies before they are taken for burial. It also teaches about grief support. It teaches about funeral service management. Now, in this particular course, the people who are going to interact with me, especially in the Eldoret campus, because that is where I'm based, are going to be exposed to both classroom instruction and intensive practical training to prepare for work in the hospitals, funeral homes, county morgues, and disaster response units, especially when we have mass fatality incidents where we have people who die. So we train people who can work in such incidences and places. Now, the requirements for this particular course, the diploma program, just like the perioperative theatre technology, runs for 1.5 years. And the mean grade is KCSE, C-, and above grades per subject. Apart from that, the program, we have the certificate program that goes for 1 year, and the requirement is KCSE, mean grade of D plane and above. This course is also examined and certified by TVET and CDAC, and the licensure is usually given by KHQA. So once our students go through our curriculum, they do their final qualifying exams, we release them so that they are able to do them. We release them, they do the license exams, so that they are able to be licensed. On to the next course. Now these ones are short courses. We have CPD courses, and the first one that I'm going to talk about is the SHA billing. When I talk about the SHA billing, I'm simply talking about the insurance. Knows that this is the most reliable insurance even to the common mwananchi. So this course prepares you for in-depth knowledge of Kenya's health insurance. Sorry for that. Sorry for the background noise. Someone just unmuted. Sorry for that. So this course prepares you for in-depth knowledge of Kenya's health insurance system and SHA billing procedures. Now, the knowledge gained from this particular course, ITEL C671L, kindly mute. Thank you. So this particular course helps in processing of claims. It helps us in medical coding. It helps us with financial reconciliation to enhance efficiency in the healthcare administration. And when I talk about this, basically, every one of us has been sick at one point and they've been admitted. Now, anytime after you're treated or before you are treated, they usually have to check your insurance and they have to deduct from it so that the care that you are given is deducted from the amount that you've been contributing. So that is the short course that we are offering in regards to SHA billing. Now, this course is usually relevant to health records and information officers, the people who are billing clerks and front office personnel. We have hospital administrators and accountants. We have clinical officers and nurses, and even healthcare practitioners in financing roles. Let's take an example of health financial engineers. They can also take a short course in this. And just a continuation of it, the requirements, the minimum qualification is a KCSE certificate or equivalent. And because I've said there's some people who stand a greater chance because they've already interacted with the healthcare. So the preferred qualification is certificate, diploma, or relevant work experience in healthcare or administration. And the recommended skills is basic computer literacy for billing sessions. The next course that we offer as a short course is the hospital administration and customer care. And the objectives, or rather the goals of us teaching this course is to, one, understand the people who are taking it to be able to understand hospital systems and administrative roles. We have professional communication with patients and staff. We have to teach our healthcare workers about reception, scheduling, and file management of patients so that there is that continuity of care. To ensure ethics, confidentiality, and insurance billing. I always say there is no proper healthcare without ethics, confidentiality in the service that we are providing, and in this case is insurance billing. And then healthcare ICT and management systems. The target audience for this particular course, we usually have the hospital receptionists and admin staff. We have health record clerks. We have customer care in healthcare. Now, the mean grade or entry point is a KCSE of this lane. And then career switchers can also do this. And then the other course that we offer, a short course at Macmillan Medical Training College, we have phlebotomy. And when I talk about phlebotomy, even before I read my slides, I'm simply talking about the people who usually withdraw blood before they're taken for laboratory checking so that they can check which disease you're having. So this particular course prepares healthcare workers to perform safe, ethical, and accurate blood specimen collection. The course follows a blended approach, combining online theory with supervised practical experience. And our target audience here are our nursing assistant students, nursing students and professionals, laboratory technicians and assistants. We have clinical officers and medical students, healthcare workers needing phlebotomy skills, and public health professionals. All those are eligible. And the entry requirement is usually a minimum KCSE grade of D plain or D minus. And the preferred background for this particular people, because we know this is withdrawing blood, especially from the veins, the arteries. So the background is usually healthcare background or current practice in medical field. Technical requirements is someone should just have basic computer skills, because after this they're able to maneuver with it. Now on to the next course that we offer. We have strategic leadership in healthcare. And when I talk about this, this usually focuses on strategic thinking, health system governance, decision making, and team leadership. Now, it is ideal for current and aspiring leaders in healthcare settings. And the target group for this particular short course that we offer is medical officers, clinical officers, dentists, hospital managers, and health administrators. Another short course that we offer, we have certificate in mental health and psychosocial support. From the name, it is a course that helps teachers or rather help us produce professionals that are good in mental health support. So this certificate equips learners with practical knowledge and skills to provide basic mental health and psychosocial support to individuals and communities affected by stress, trauma, displacement, and adversity. Simply this humanitarian crisis. So we offer this course. It aligns with WHO and IFSC guidelines and is tailored to Kenyan and African context. So the target group for the people who can do this course is community health workers, volunteers and humanitarian workers, teachers, religious leaders, peer counselors, social workers, health professionals seeking foundational HPSSS knowledge. So basically, someone who wants to be taking part in the counseling psychology can take this as short course. It puts them a step ahead or a step notch higher. Now, the duration for that short course for mental health support is 3 months or rather 12 weeks. The other short course that we have is certificate in inventory and medical supplies management. And when I talk about that, you know that the hospital is a place that new people are admitted, others go, new supplies are used, others are released. So we have people who have to keep on checking these supplies. So we have certificate in inventory and medical supplies management that enables one to work in the hospital. So this certificate course is designed with participants with comprehensive skills in managing medical inventories, procurement, warehousing, and distribution within healthcare system. It is offered by the MMTC, Macmillan Medical Training College, and the program also empowers learners to pursue entrepreneurial ventures in medical supply sector. So our target group are the school leavers, health workers, procurement assistants, and aspiring entrepreneurs. Now, the course usually takes 6 months. The duration is 6 months. And the entry requirement is KCSE certificate or equivalent. So we usually offer this course via study modules, and you can either do it full-time or even online. We just talked about international job linkages. And for anyone who is interested to go and work into the English-speaking countries, we know one of the requirements is usually the English exams. So at our institution, we offer international English language testing system, what everyone talks about as IELTS. It's IELTS training prepare individuals planning to either work, live, or study in English-speaking countries such as the UK, Canada, Australia, New Zealand, Ireland, where we all do connections to our candidates after they've studied with us. So the duration of this is usually 4 weeks, and the certifying body, or rather the body that sets the exam, is the British Council. So after the 4 weeks, you'll do the exams by the British Councils and get your results. I think I've come to the end of the presentation. I welcome you all to the Macmillan Medical Training College family. Welcome to experience flexible, student-centered learning guided by expert instructors dedicated to your success. Thank you so much and welcome again.
Thank you so much, Ms. Barnes, for that. We are grateful for that amazing presentation, taking us through the courses that we have, the diploma, the certificates, and the CPD courses. So you will get to learn a lot. We have webinars, we have trainings at Macmillan. Luckily, today we have a free webinar. I'd ask Madam Daisy to post the link or the Zoom link or the chat box. So we'll be having that free webinar today. People who are interested in joining the NGO world, there's a lot to learn from the webinar that you're going to be having today from 7 p.m. So if you are going to be joining Macmillan, you'll be sure of continuous development programs, trainings, so you're in the right place doing the right thing. The link for the webinar will be shared, or the training will be shared on the chat box. So let's have the link so that we're able to attend that free webinar. Most of these webinars are charged, but as Macmillan, as part of giving back to the society, we offer this training and give this knowledge at no cost. So thank you so much, Ms. Barnes, once again. I would want to welcome Miss Winnie Omolo for the accreditation, documentation, and placement process. We'll then have finance to top it up for us with the financial obligation. And then we'll have the question and answer session, and then we'll be done. So let's not drop off the call. We are a few minutes away from being done. It's good that we listen through to the entire orientation so that we know what we are needed to do, what is expected from us as students. It is very important to follow through the conversation to the end. So let us have Winnie coming through with that segment on accreditation. We'll then have our finance officer taking us through the financial application. Karibu sana, Winnie.
Thank you so much, Madam Sarah. I hope everyone is able to see my screen.
So, Barnes, you can stop sharing, and then Winnie, you can start sharing yours.
No, it's Winnie. Are you able to see my screen?
Yes, we're able to see your screen.
Okay, so I'm going to take us through accreditation, documentation, and job placement process. So most of these abbreviations, we've learned about them. I'm only going to talk about the last one, that is GHIC. It's going to appear in our document today. So it's Global Health Immigration Consultancy. It's a firm. I'm sure some of you might have asked themselves the question when they were shopping for schools around, and one of the questions could have been, is Macmillan accredited? And another question would be, why is accreditation that important? So accreditation is all about quality assurance process where an external body, this could be TVETA, CDAC, SDCC, or Nursing Council of Kenya, evaluates a medical school's curriculum, faculty, facilities, administration, and its outcomes. Then why is accreditation important? Accreditation basically ensures quality education. So it guarantees the learner that the curriculum meets national and international standards. As we all know right now, is that we are training effective workforce for not only the Kenyan country, but also for the global market. Then it also ensures eligibility for licensure. So upon getting a certificate from Macmillan Medical Training College, you can use it to obtain license from relevant regulatory bodies within and outside the country. Then also accreditation ensures that you gain public trust and reputation. Imagine this scenario if you trained from an institution that was closed down either by Nursing Council or TVETA as not meeting standards, and then you are to attend to a patient who has this knowledge that you are from this institution. I'm sure the outcome will not be likely good or pleasing. Or if you were to seek for a job from an employer who also knows that you're coming from an institution that was shut down, then you might fail to get the employment. So to gain public trust, an accredited institution, it signals patients, it also gives a signal to employers and other institutions, and basically the general public, that the school produces competent, ethical, and skilled physicians. Now, this just gains trust for our students. Now, without accreditation, then it's just the opposite of what we've talked about. Students may not be eligible for licensing in many countries. Then certificates may not be recognized by hospitals, employers, or those who would wish to further their studies for degree programs might not get a chance to do that if the institution is not accredited. Then the documentation process, this is basically done in two, that is the translation. This has been talked about by one of my colleagues, Mr. Sinali. Notarization has also been talked about, and this is basically done by the consultancy firm called GHIC. So if you are not a student, you need to register with them. And if you have the necessary documents that we are going to see in the presentation ahead, then you are eligible to apply for various job opportunities. Then the placement process, I'm going to talk about the current opportunities that we are having at GHIC. We are having opportunities in Canada, New Zealand, and Ireland. Now, for these three countries, you will need an IELTS score band 6.0 for CNA, and for registered nurses, that is 7.0. For these countries, they need medical professionals. Those are registered nurses, certified nursing assistants, and doctors. And if you're a student, you don't need to pay. If you're a student at Macmillan, you don't need to pay application fee. But if you're not, you need to pay an application fee, and there are charges also incurred. So if one is interested, then we can share more details on the same. Then they also help you with visa preparations, and also provide someone with at most 4 employers. So, it is not 100% guaranteed that you will get this job, because it's also pegged on the interview, how you perform during the interview. So if you fail the first interview, you're provided with another employer, do another interview. If you fail again, do another interview, so forth until the fourth one. But we at Macmillan, since we have highly qualified and skilled trained tutors, failing these four would be has not been experienced, and we are hoping that you'll be able to go through them. So placement process in Germany has been talked about, and just to emphasize that for our students, the placement process is free, but if it's a student from outside having a German language of up to B2 level, then they pay a registration fee and 350 USD for administrative purposes. And at Macmillan Medical Training College, we are fully accredited and equipped with modern state-of-the-art facilities. Our programs have been rigorously evaluated by the relevant regulatory bodies and found to meet the highest standards of medical training. So if you are already with us, you've registered to start your studies with us, you're in the right place. And if you are not yet registered, this is exactly where you need to be. Our registration is still open up to the end of the month, and we also would wish to inform you of our 8% discount on all tuition fees only for this September intake, and the 40% discount on German fees only for this September. So hurry up while the slots are still available. That brings me to the end of my presentation today. Back to you, Madam Sarah.
Thank you so much, Winnie, for that presentation. It was very precise and very to the point. So we are grateful for that. I see there's a lot of questions on the chat box. We are going to answer each one of them. But before we get to answering, I'd want to call in our finance officer, that's Mr. Peter Ngede, to just take us through what is needed from us as students, what is needed from us as parents, what are our financial obligations. Then once we are done, we're going to have a question and answer segment, and then we're going to call it a day and meet you in class on Monday. So meanwhile, center managers share the timetable, the class timetable to the groups. If you're not in the WhatsApp group, if you are an enrolled student and you're not in any WhatsApp group, kindly the chat box. We're going to tag the names and numbers of our center managers so that we're able to get in touch with them. Karibu sana, Peter.
Good evening, everybody. I hope I'm audible enough to everybody. Okay, so I will carry on. First and foremost, I would like to welcome everybody into our institution. It's a great pleasure to interact with some of you. There are those we have interacted directly, those who visited the office directly. So welcome to institution, and again, congratulations to the CNA students, to those who received the 8% on tuition fee, registering early on time. Now, I will quickly take you through your financial obligation because most of it has been highlighted by my colleagues, and I'll just take you through the steps so that you are prepared on what you're supposed to do, by when, and maybe what are the repercussions of maybe not following through with the said obligations. So the key four areas that, of course, that I'm going to tackle will have the tuition and fees arrears. I will talk about the refund and withdrawal policies. I will talk about the cut and main exam procedure, which has also been spoken about by the registrar, and then the exam fee payment, but particularly this is for the CNA students. That's where now again I will talk about it. So I will give you different scenarios. So we have the first scenario is we have a student who is doing CNA alone. So we had shared in a brochure. So a student who is doing CNA alone, you are required to pay at least 36,890. I hope my screen is visible. If it is not, don't worry. in every fee payment that you make, if you make a payment, I normally issue a receipt, and below it, there's going to be an invoice that indicates or breaks down the remaining fees per level. So each time you make a payment, I send you a receipt and an invoice indicating the breakdown, that is the date that you're supposed to make the payment and the amount that is due. So it's going to be for the entire course, and it's always going to be at a reducing balance. That means kila ukilipa inakuja ikipungua na kwenye umefika. Okay, so we have a scenario of a student who is doing CNA alone. So this particular student is supposed to pay at least 36,890 before joining the classes, that is on the 15th of September. So that is 36,890. Then we give you a grace period. So that means
I think the screen is not so visible. Mr. Peter, if you can enlarge it or zoom us in so that we're able to see the figures, or
let
put
me
it
see if
on
I'm
slideshow mode, or any other mode that makes it visible. I'm sure our students would want to see the figures.
Give me a moment.
So as he sets up, let us enroll. On the chat box, there is a form that was shared. Center managers, kindly on the chat box, write your names, then your numbers, and the campus that you represent. If you have not been added to any WhatsApp group, kindly do so. I see someone is already asking, I didn't receive my receipt. This will be addressed. Thank you, Mr. Peter. I think it's a bit visible now.
Okay, so as I was saying, the receipts are going to be forwarded into your emails. So far, so good. No student has received theirs. So you're going to receive a receipt of the application fee. So if you have paid the application fee, you'll receive a receipt of the application fee and any other payment that you've paid directed to your school account. And then there's going to be an invoice attached below it, and the invoice will look like this for those students who are doing CNA alone. So as I was explaining, a student who is doing CNA alone is required, assuming you have already paid the application fee, because you can't receive an admission if you haven't paid the application fee. So that means you're required to pay at least that 5,140. That is before entering the classes. That is on the 15th of September 2025. Then we normally give you a grace period. So after that, on the 1st of November, which is the last month of your phase one. So we said phase one is 3 months. So on the last month, which is going to be the 1st of November, you're going to pay the remaining 30%, which is going to be 15,060. So remember these dates that I'm putting, it's not when you're supposed to make the payment, but rather the deadlines of making these particular payments. Then we are going to have phase two, which is normally a month, and it's highly intensive practicals, which you're going to in preparation for your internship. So by 1st of December, you're supposed to make a total fee of 37,300. And I had said I congratulated CNA students on receiving the 8% discount. So the discount applies in the phase two. Normally, our phase two fee is normally 42,500, but the student received an 8% discount. That is 5,200. So that is equates to, by phase two, 1st of December, you're supposed to make a payment of 37,300. After completion of that payment, you of course expected now to start joining your internship, and you're supposed to make the internship payment by 1st of January 2026. So this is in preparation for the internship slots, and in preparation so that when you're going there, you don't have restrictions regarding the same. So again, I will revisit the same, because we've been having this time and time again with our students. So kindly make sure by when these deadlines are met, you don't have a delay in the same, because what normally happens is you're either restricted from going to the internship, or your slot is taken up by someone else. So maybe we can adhere to this. So we are going to have final TVET CDAC examinations, and this again is another opportunity that our CNA students have. For those people who are doing CNA, you're going to graduate with us with different certificates. You're going to have digital literacy, that is free. You're going to have HSS level 4, which is also known as the caregiver. So those are taught free. So the 15,500 that you see here, TVETA CDAC exams, this is going to, it's applicable, it's the exam fee for the caregiver course, which is HSS level 4. So after that, you're required to make your CNA final exams, and this is after coming back from your internship of 2 months. So by the 1st of February 2026, you make the 100 USD. Again, I will explain on how you're going to make the payment of the USD payment. So the 5,000 graduation fee is normally the last thing you do. That is after you've done the exams, you've passed the exams, and you're qualified to graduate. That's now when you make the payment. So again, we will have a question with students who are doing both CNA and German language. So for CNA and German language, the same thing applies. Let me just zoom in the screen so that you can be able to see. So the same breakdown that I have given for the CNA course applies for the German CNA course. So the only difference is that a student who's doing both, you are exempted from again coming to pay the library activity and the t-shirt fee in the German language. So what you're going to make is, let's say you're joining in, you pay the 35,140 that I said, assuming you've already paid the application fee. Nalipa 35,140, that is for the CNA course. Then before joining, you pay 15,000, that is for the German language. So you'll have been exempted from double paying the library fee, activity fee, t-shirt fee, and the ID because it's already covered in the CNA course. So that means before Kuje Apa, you're supposed to make a total of 56,890 for those who are doing both CNA and the German language. I will give a scenario of students who are doing purely the German language. So German language is normally billed per level. So there are those who are going to start at level A1, those who are going to start at level A2, B1, B2. So we go in subsequently. Once you finish one, each is normally 2 months. So once you're done with your level 1, now again you come back, you'll receive an invoice for the A2, now which you're going to pay before joining. So a student who is doing German alone, assuming you've already paid the application fee, so that means you're supposed to come in with at least 20,200 shillings. So that will cover your A1 application fee for 15,000, ID 700, library 2,000, activity 1,500, and then the t-shirt 1,000. So the last thing which you normally pay in the last month, that is the second month, you normally pay 1 week, at least 1 week before the German language, which is 5,000 Kenya shillings. So again, I will say A1, A2, all B1, those exams are internal and they are conducted here at our premises. So that is a scenario for those students who are doing. I hope you've gotten it. I will quickly go through the students who are doing perioperative. So I will tackle both. So I'll tackle both students who are doing both the level 6, which is the diploma level, and the level 5, which is the diploma. For you guys, there's not a lot into play. What you're required to know is that for yours is not like the level that you pay per month, or you pay timely, just the way I have demonstrated for the CNA course. So for yours is going to be a little bit different because yours it's timely. So as you are aware, certificate goes for a 1 year, then we are going to have the perioperative diploma for 2 years. So in each term, you're required to at least pay 70% before commencing your classes, then 30% on the last month, which is going, of course, to be the 1st of November 2025. So before you come in on class, that is on the 15th, you're required for the diploma, you pay the 70%, which is at least 26,600. And then for the certificate, you pay 22,100. That is the 70% before joining. The 30% remaining, you're supposed to make it by the 1st of November 2025. Then the same case subsequently follows into the next semester. If you're going to semester two before paying, before joining class, you again pay 70%. Then on the 1st of the last month, again, you finish the 30%. So this applies for both, it applies to both perioperative, and it also applies to the HSS students. So the HSS students, this is level 5. So you're going to differentiate between the level 4 and the level 5. The level 4 is the caregiver given in the CNA, but now this is purely a different course, which is the HSS level 5, which is normally a 1-year course. So again, you're going to pay 70% per term before joining. Then on the first of every last month, you complete the remaining 30%. So the examinations of the HSS level normally goes per unit, and per unit is charged at 1,500 shillings. And this is payable at the end of the third semester. Computer programming students apply the same principle. I'm trying to be fast in so that I can be more elaborate and also save on time. So computer, for these long-term courses, the same principle applies. Before starting any term, 70%. On the first of the last month, unalipa the remaining 30%. Now, so that is understood, I will deeply go through the refund and withdrawal policies. So most of the time you'll find in that you are admitted in our school, and then you got a different opportunity of going maybe outside country, and you want maybe a refund or to defer. So kindly note that we only do a 30%, 70% refund to students when they have not started any activity. So let's say you wanted to opt out, you'll only be refunded 70% when you haven't begun any classes with us. If you started any class with us and as we have been in class for 2-3 days, what normally happens now that we call a deferment. So the payment that you have paid is withheld in your account, and when you come back at a later date, when you're prepared, now you continue with the fee payment from where you left off. But only the refund is only applicable to where the student has not even joined any classes so far. Again, the deferment procedure. So if you want to make a deferment, you kindly write an email to admission@macmillancollege.ac, and this is a prior communication. Write it as an official communication stating the reasons why you want to defer, or maybe why you want to opt out. You just don't opt out without maybe giving any reason or not giving any information. And this goes in because most of the time, if you don't share in the communication, the billing again will continue unless a proper communication is handed down. I will go to the CAT and examination procedures. So as the registrar had explained, for any missed CAT, not the main exams or the final exams, for any missed CAT, if you miss a CAT or you fail to attend, you're going to make a payment of 1,000 shillings per CAT. So let's make sure we don't miss any CAT. We adhere to the timetable and the schedule. So if you're sick, kindly issue, just as he said, kindly issue a notice. And also when you come back, come with supporting documents to provide the same. Any exam irregularity again is not tolerated. So when you're caught in the exams, maybe doing stealing of the exams or using materials that are not permissible in the exam room, you're going to do again a retake. And when you do a retake, that means for the main exam for CNA, each retake is 5,000 shillings. Perioperative main exams, 5,000 shillings. So any main exams, if you're caught stealing or you failed it and you're coming to do a retake, you're going to be charged 5,000 Kenya shillings. So I hope you understood there. So I want to go to the main point of where I said I will explain about the USD account. And specifically, this is for the CNA students. So for the CNA students, the final exams, which is payable in 100 USD, kindly note that this payment is not payable via the pay bill. So you visit any NCBA bank. In your invoice, there's going to be an illustration of the account details. So you provide the Macmillan University Limited USD account highlighted there and is normally bolded out in red. Let me just again go back and give you an example of how it is bolded out. So this is how it is bolded out. So you are required to make a payment of 100 USD to the USD account. It's state payable to the USD account provided below. And the USD provided below account is 64. Just give me a moment. The provided account there, it can't zoom down because I had broadened it so that everybody can see. So this is the USD account here, the 6286140024. So that's when it's going to be in bold in your invoice. So you make that payment there. You just visit any NCBA bank. They will provide you with the rates. Once they provide you the rates, remember rates are normally negotiable. So you can renegotiate with them. So once you renegotiate, they give you a cash deposit slip of 100 USD. So that slip, that's what you come back with us as a proof of payment. Then we'll counter check with the reference that that particular amount reached our account in USD. Remember, don't go online to Google rates because each bank has different rates. And when you Google, most of the time the rates are not clear. So what you find, you use the pay bill to make the payment to the USD account. But when it comes here, NCBA automatically converts the amount into their rate. So what that means is you'll come for your final exams, then you'll find Mr. Peter and atakuambia that you have not met your final payment, so you have to top up, which again maybe will delay you from joining the exams in time. So I hope that is well understood. So maybe what I can give you, I'll answer questions later in the open-end Q&A. So I want to welcome you again, once again, to our Macmillan community. Feel welcome. And my number is broadcasted everywhere. If you have any difficulty or if you have anything that you need directly to talk to the finance, feel free to contact. So welcome once again, and thank you for joining us.
Thank you so much, Peter, for that presentation. I hope we now have an understanding of what is needed. But if you're a bit confused, check your email. We send our invoices and receipts on email. I see, let me just see if we have questions in the chat box. Of course, there are questions. Mr. Peter, can you reduce volume so that we don't echo? Okay. Someone is saying I didn't receive my receipt. Kindly, anyone on the chat box, write Peter's number so that anyone can get in touch with him if there's any sort of question or clarification that you may need. He is going to check.
Sir, just kiddo.
Okay, Mr. Peter, go ahead.
Kindly, for those who ask, they haven't received, they are saying they received, kindly wait. I know a lot of people are going to have the same, they are going to be shared to you. So kindly wait for the same.
Okay, so the receipts are going to be shared. I'm trying to see if we have questions. Okay, I see some of you are saying they have not received their receipts. So that's going to be shared with you. So someone is asking if the 26,700 is part of, if Scrubs is part of it. So we are sharing also the fee structures. So in our WhatsApp groups, kindly admin share fee structures. These details are there. For the CNA, of course, for the first installment, you're going to have your Scrubs. Someone was asking about the form I have shared. Nakuru, you've seen you've done well. You have written your directions to your campus and also tagged the number. Let us have the rest of the campuses do that. When are we going to be given the Scrubs? Probably around the second, third week, but before that, because we need you to go to your tailor, get measurements, and then we will have your Scrubs imported. Yes, finance number is there. The timetable is being shared in the group. So center managers kindly share the timetable so that the students can know where to start from when the school begins on Monday. So class officially starts on Monday. The timetable will be shared. But on Monday, pretty much we'll do more of orientation, physical orientation. Come in to Macmillan, We'll show you the amenities we have, whatever we have, what is expected from you. At what time should we arrive on Monday? So this question becomes a bit hard to answer because we have Nairobi, Mombasa, Eldoret, Nakuru campus. So kindly center managers will send the timetables to the WhatsApp group so that the students are able to see when class will start. We can, if we have anyone with a question, they can unmute and ask. Meanwhile, I'm looking at the chat box. Help, is help allowed? Someone is asking about help. So we are not registered under help per se, but we are on process for the same. But we take in checks, whether it's a bursary from your MP, whether it's you've got some sort of funding from any NGO. So we do accept that. So we take in checks, whether it's from your MCA or your MP. What sports game are offered? We have football, we have indoor games. The German language fee structure. Kindly on the same groups, let us share the German language fee structures. On the website, we can have someone on the chat box also share access to the website. That's the link on the website and the application, the e-form, for those who have not applied and would want to apply. So the e-form you can, someone is asking that they would want to add the German language, how do they go about it? So also on the chat box, we are going to have the admin text their email and number so that we're able to get in touch with the administrator, that is Agnes, so that if you want to add any course, you are able to do that very comfortably. She will guide. So someone is asking about documents, that they have not submitted documents, like the Form 4 certificate and the passport size photo. What are they supposed to do? So kindly, we need these documents. So share your Form 4 certificate, your ID, your passport size photo to the admin. So admin, kindly on the chat box, text your email so that students are able to send you their documents. Someone is asking about the house building program. You're going to share those slides as well. So in terms of fee payment, is it mandatory to pay the whole amount? We have the designation of what amount should be paid by when. So look out for your invoices. You will get that guidance. Also on the fee structure. So kindly let's tag the fee structure. Let's put the link here so that people are able to see. Okay, so I will mute my mic for a minute. For anyone with a question, we are here to answer your questions. If you have any recommendation, we are here. You can also recommend. So someone is asking, can they change the course? Or maybe move towns? Yes, if you, let's say you're in Eldoret and you want to come to Nairobi, you can. You're not restricted. Macmillan operates across 3 towns, that is Nairobi, Mombasa, Eldoret, and Nakuru. So karibuni sana. You'll get your scrubs in about 2 weeks, 3 weeks thereabout. We need your measurements so that we may be able to get them. Are we supposed to buy a laptop or maybe for the CNA course? I see someone is asking. We'll provide you with notes. Are you allowed to be in class if you haven't reached the 70%? So you can get in touch with the finance on the number that was shared. Agree on a payment plan if you have to. So he will give guidance on what should be done. And remember, from Monday to Wednesday, we're going to have a free German trial class. So for those who are not so sure if they want to take in the German class, We shall have a test class at all our campuses for German language. So if you're taking CNA, for your CNA class, you can jump into the German class, see if it's something you may be able to take, see if it's something of your interest. And then after Thursday, we will need to make payment. So someone is asking how many units for perioperative. So pretty much these are now personal questions. You're going to be taken through with your tutors. They'll offer to you a course outline, the courses you're going to take, and timetable. Okay, I think that's it. Having no other question, I think we can end the meeting. I will let our quality assurance officer say hi to us and maybe just officially welcome us to Macmillan. Mr. Lima, if you're able, you can say hi, but I think he's a bit occupied doing something else. We can have Beldens having a closing remark. Anyone with anything, this would be a time to say something, but if there is none, we could have our registrar giving a closing remark, then we can end it. We can have Mr. Oro if Mr. Beldens is not in. Okay. Yes. We can have Winnie give us a closing remark.
Okay, thank you so much, Madam Sarah. To our students, to Macmillan family, part of our family. We care about you so much. It's with a lot of pleasure that we welcome you to this institution that is now going to be your second family. We are so proud to have you on board, and we are looking forward to engage even much better. And at the end of the day, when you get the quality in education that we're going to offer you, you'll be selling us out there, and we'll be proud to meet you in the corridors of our hospitals. So we are looking forward to having you in our classes. Thank you so much for joining in, and thank you so much for choosing Macmillan to be your learning partner. That is all from me today. Back to you, Madam Sarah.
Thank you so much, Winnie, for that. I encourage all of us to push and make sure we are in class. Sometimes you might feel like you need more time to be out here. You will push your reporting time to next week but one, or you decide that you want to join school in January. Sometimes when you want to get something done, just get it done. Don't feel confused about you applying and wanting to study. So let's take it up, be in our classes. We are happy to have you. Congratulations for this amazing milestone. And I'm looking forward to having you guys as part of Macmillan family. We are such a big family, and we are accommodative of each other. And we know it's going to be a smooth sail. There could be ups and downs, but we're going to make it at the end. I'm looking forward to seeing all of you at the graduation square when we finish our study, and we will be able to tell you, we'll be able to congratulate you. So I just see a few questions on the chat box. I don't want to close without addressing. So the 7 p.m. Meeting is a training, a free training. So if you're able to join, kindly join it. You're going to have free training for a humanitarian course. We have student portal. We will have it. That will be shared to you. You're going to have access to the portal at a later date. If someone is asking if they can come with their parents, yeah, sure. If you want to come with their parents on Monday for them to see the school, we will not restrict you from doing that. I think that's it. Okay, Mr. Victor is also here. He can say hi, and that's our quality assurance officer. Thank you. Karibu sana, Mr.
Hello, everyone. My name is Victor Human. College, but for the education quality, and will ensure from the start that you acquire quality. You know, we are going to interact much of the time, go be it in the classes or rather in corridors or corridors, skills lab. Yeah. Thank you, sir. Back to you.
Thank you so much, Mr. Olimo. I think we can close it. I see 2 things on the chat box. So someone is asking if they share the remaining documents on the chat box. Kindly, Winnie, help me text the admin email on the chat box so that we can have our students send their documents there. Someone is having a request. Kindly make that request through the finance desk. His number is there. Mombasa hostels. The number for Mombasa, I think, is here. So center managers, kindly let's have that information on the chat box. It's there. We will not end the call. Rather, once you're done, you can drop the call. There's a lot of information that will be on the chat box. If you have any question, inquiries, kindly stay back. We'll have about 20 minutes for personal questions and interactions. Also, we can have, thank you so much, Beryl. Beryl says, thank you, Madam Sarah. I'm now comfortable to be at Macmillan. Thank you so much. We appreciate. So let's have our questions at the chat box. Let's have the e-application on the chat box as well for people who want to apply. Let us have all center managers tag their numbers there. So for measurements, are we coming with them on Monday or there will be a school tailor? So we'll have the measurements taken by the end of the week. We don't have to rush it. So let's take time, come into school, interact. We will have the measurements taken, or rather you will bring the measurements to us. Thank you so much. So we can call it a day. It was a good afternoon. Have a lovely evening. We'll not drop the call, but we'll let us to interact with each other on the chat box, on the call. If you have any question, you can always ask. Thank you so much. Nairobi, kindly, we are not seeing your contact. We are not seeing the emails. Upload that. Thank you so much. Have a lovely evening. Masikio uko nayo, lakini kusikia wapi? Okay.